I'm excited to speak at meetings all over the country because we have had the opportunity teaching through the Dawson Academy, where we've had over 40,000 dentists come through courses here, both in St. Petersburg as well as around the United States. And we're now teaching in different countries around the world to understand what the challenges are that dentists have. What is it that they're struggling with in their practice that they want to master to become the very best they can be? There's a few areas. One I would say is we learn very little in dental school about dental occlusion. And so bite relationships, problems of the bite, how to do aesthetic, cosmetic, restorative dentistry, and actually solve problems and certainly never cause problems is a big concern for dentists. They don't understand about centric relation or anterior guidance or vertical dimension of occlusion or why people clench and grind. These are the topics that we can talk about when we meet together about dental occlusion and restorative dentistry. The other thing that we don't learn much about at all in school is about the temporomandibular joints and what we might call TMJ disorders. So whether there's a problem in the joint or whether it's just someone simply saying, my bite is uncomfortable, I'm clenching, I'm grinding, I have sore muscles, I have headaches, sometimes I wake up with headaches in the morning, or my joints clicking, my jaw's locking and tight. All of these things are subjects that obviously are right in the center of dentistry, but very few dentists are comfortable with understanding how to differentiate what's going on, how to make a diagnosis, how to treat and solve these problems. So we can talk together about all of those things and how to resolve those things. I'll give you a decision tree of how we work through resolving these problems. The third subject that I'm really excited about is the future of dentistry and the frontier of dentistry as we move forward. I believe that dentistry should be on the front lines resolving and involved with resolving the healthcare crisis that we're so significantly experiencing. How do we do that? Well, the main topic in medicine today, as you listen to the researchers talking about all the different issues of health and accelerated aging, is the buzzword inflammation. Inflammation is the topic, whether you're talking about atherosclerosis or you're talking about diabetes or you're talking about Alzheimer's. Inflammation is the key thing. Inflammation is something that we're very familiar with in dentistry. We know that inflammation is red and swollen and bleeds easily, and we can touch it when we look in the mouth, but what we don't often connect it with is whole body inflammation. This is something that is a growing topic. There's many of us in research and in education that are talking about this being the next big thing in dentistry. Whether we're talking about the oral systemic connection of oral pathogens or bacteria and their role in the bloodstream and the gastrointestinal tract, or we're talking about the role of airway and breathing and how that can affect our patients' systemic health, such as sleep apnea and problems with breathing, how that affects the formation of the dental arches and creates malocclusion when there are breathing problems, and tongue position and things like that that we're learning about. Gastric reflux, which can manifest itself first in the mouth as erosion or wear on the teeth. We in dentistry may discover that someone has gastric reflux just through screening, and yet we're learning that gastric reflux can be involved with esophageal cancer, which is the fastest growing cancer in the United States and is often undiagnosed. We can pick up on it very easily through dentistry. So I'm excited to talk about what I call integrative dental medicine, integrating all the things that we can to prevent disease, as well as our solutions to those that present with active problems. So there's a number of topics that we can address, even in the same meeting, if you would like. I have half-day, full-day presentations on all of these things that we can share with those attendees at courses that you may be putting on, sessions that you're having with your contingency. So I would love to come spend time with you and share what we're learning. I've been very fortunate to spend 35 years in an office that is dealing with problem solving every day, from temporomandibular joint to bite relationship to aesthetic concerns to whole health concerns. And these things that we have learned I would love to share with you.